Vitamin D, its essential role across the health spectrum. What are new studies telling us about dosage? Welcome to our latest blog post, where we'll be discussing one of the most important vitamins for overall health, vitamin D. From maintaining strong bones and teeth to supporting a healthy immune system, the benefits of this essential nutrient are vast. But with new studies emerging on the optimal dosage and potential risks associated with excessive intake, it's important to stay informed. In this article, we'll delve into everything you need to know about vitamin D and how much you should be taking daily. So sit back, grab a cuppa and let's dive in. What is vitamin D? Vitamin D is a fat-soluble vitamin that plays an important role in the body's overall health. It exists in two forms: vitamin D2 and vitamin D3. Vitamin D2 is primarily found in fortified foods, while vitamin D3 is synthesized by the skin when exposed to sunlight. Once absorbed into the bloodstream, vitamin D travels to various organs such as the liver and kidneys, where it undergoes biochemical reactions to become active. At this point, it acts as a hormone and helps regulate calcium absorption from food. Calcium absorption is essential for strong bones and teeth, making vitamin D crucial for skeletal health. Additionally, research suggests that low levels of vitamin D may also contribute to several chronic diseases such as cardiovascular disease, multiple sclerosis, and certain types of cancer. While some people can get enough vitamin D from exposure to sunlight or through their diet, fatty fish like salmon are rich sources. Many others require supplementation or fortified foods to meet their daily requirements. What are the benefits of vitamin D? Vitamin D is known as the sunshine vitamin, and for good reason. When our skin is exposed to sunlight, it produces vitamin D naturally. This essential nutrient has a variety of benefits that are crucial to maintaining overall health. One of the most significant benefits of vitamin D is its role in calcium absorption. It helps our bodies absorb calcium from food, which is necessary for building strong bones and teeth. Without enough vitamin D, we may experience bone loss or weakened bones. Moreover, research suggests that adequate levels of vitamin D play an important role in supporting our immune system function by reducing inflammation throughout the body. Additionally, studies have found a correlation between higher levels of vitamin D and lower risk of certain cancers such as breast cancer and colon cancer. Furthermore, some research shows promise in linking sufficient levels with improved mood regulation among individuals suffering from depression or anxiety disorders. Finally, yet importantly, recent studies suggest that having healthy vitamin D status may reduce your risk for developing autoimmune diseases like MS, multiple sclerosis. Getting enough vitamin D can greatly impact our health positively on many fronts. How much vitamin D should I take? The recommended daily intake of vitamin D varies based on age, gender, and overall health. Adults between the ages of 19 to 70 should aim to get at least 600 international units, IU, per day. However, some experts recommend as much as 1,000 IU. For infants up to a year old, it is recommended they receive anywhere from 400–1,000 IU per day depending on their feeding method and other factors. Those over the age of 70 require more vitamin D than younger adults. Around 800–1,000 IU per day is suggested. It's important not to exceed the recommended levels of vitamin D intake, as too much can lead to toxicity. The tolerable upper limit for adults is estimated at around 4,000 IU per day. But this information and recommendations may be old information, as newer studies have made older studies obsolete. It might be that we will soon see dosages as high as 10,000 IU or more. This is not medical advice, but you should do your own research. If you're unsure about how much vitamin D you need, or if you have any underlying medical conditions that may affect your absorption or utilization of this nutrient, it's always best to speak with your healthcare provider, who can provide personalized recommendations based on your unique needs. What are the side effects of taking too much vitamin D? While vitamin D is crucial for overall health and well-being, it's important to note that consuming too much of this nutrient can lead to adverse effects. In fact, excessive intake of vitamin D can cause a condition known as hypervitaminosis D. One of the main symptoms associated with hypervitaminosis D is hypercalcemia. which occurs when there's an excess amount of calcium in the blood. This can lead to nausea, vomiting, weakness, fatigue, and even kidney damage if left untreated. In addition to these symptoms, taking too much vitamin D supplements over extended periods may result in the buildup of calcium deposits in soft tissues such as the heart and lungs. This condition is called calcification and could lead to serious complications like heart disease or lung failure. It's essential to follow recommended dosage guidelines while supplementing with vitamin D. Otherwise, you risk developing toxicity symptoms related to its overdose. However, obtaining your daily dose through natural sources poses no threat whatsoever. Are there any natural sources of vitamin D? There are a few natural sources of vitamin D that can be incorporated into your diet. The most common source is sunlight, which triggers the production of vitamin D in your skin. However, it's important to note that too much sun exposure can increase the risk of skin cancer. Another good source of vitamin D is fatty fish such as salmon or tuna. These types of fish contain high levels of this essential nutrient and can easily be incorporated into meals a few times per week. Egg yolks also have small amounts of vitamin D. However, it's important to remember that consuming raw eggs increases the risk for salmonella, so they should always be cooked thoroughly before consumption. Mushrooms are another good way to get some extra vitamin D in your diet. When exposed to UV light during growth or processing, mushrooms produce ergosterol, a precursor to vitamin D, which then gets converted into vitamin D2 when consumed by humans. While there are natural sources available for getting adequate amounts of vitamin D through our daily diets and lifestyles, supplementation may still be required, especially for those who live in areas with little sunlight exposure throughout the year. Are there any risks associated with taking vitamin D? Another potential risk is that excess vitamin D can interact with certain medications and supplements such as digoxin and thiazide diuretics. It's crucial to talk to your doctor before starting any new supplements if you're on medication or have an existing medical condition. Moreover, some studies suggest that very high levels of vitamin D could increase the risk of falls in older adults rather than decrease it. This effect has not been proven conclusively yet, but highlights the need for moderation in supplementation. In summary, while taking moderate amounts of vitamin D usually does not pose any significant risks for most people, it's important always to consult a healthcare provider before beginning any dietary supplement regimen if you're concerned about possible interactions or side effects. Conclusion: vitamin D is an essential nutrient that plays a crucial role in maintaining our overall health and well-being. Its benefits range from promoting healthy bones, teeth, and immune function to reducing the risk of chronic diseases such as diabetes, heart disease, and cancer. The recommended daily dosage for vitamin D varies depending on age and health status. However, recent studies suggest that many individuals may be deficient in this vital nutrient. Therefore, it's important to consult with your healthcare provider to determine if you need a supplement or not. While taking too much vitamin D can lead to adverse effects such as nausea, vomiting, or kidney damage in rare cases, it's generally safe when taken within the recommended dosages. Natural sources of vitamin D include sunlight exposure and certain foods like fatty fish and fortified dairy products. However, some people may have difficulty obtaining enough vitamin D from these sources alone due to various reasons such as limited sun exposure or dietary restrictions. Vitamin D is a crucial component of our diet that we should prioritize getting enough of through either natural means or supplements under proper guidance. By ensuring adequate intake of vitamin D, we can help reduce our risk of developing chronic illness while improving overall mental and physical health for ourselves.